Today we're going to talk about
Osteoporosis.
Osteoporosis. Osteo meaning bone, porosis meaning brittle. Here's an example of a healthy bone, and here's an unhealthy bone, meaning it is porous, which is less structured and prone to deterioration. The osteoporosis is a bone disease that occurs when the body loses too much bone or makes too little bone or not enough at all.
There are many symptoms of osteoporosis, which we'll get into later after our short commercial break.
This remote control to contact LifeCall, my 24-hour emergency medical response service. Watch. You just press this button and speak into the air and...
I'm having chest pain.
I'm calling paramedics and your family, Mr. Miller.
I've fallen, and I can't get up.
We're sending help immediately, Mrs. Fletcher.
See? Protect yourself with LifeCall, and you're never alone.
If you or a loved one have experienced back pain of any kind, at all, whatsoever, you may have osteoporosis. You may be entitled to financial compensation. Osteoporosis is a common disease linked to unhealthy people. Please call 1-800-BACK-HURT. That is 1-800-BACK-HURT.
Other symptoms may include, but are not limited to, loss of height, a stooped posture, and brittle bones.
I think I broke my tailbone. Diagnosis. In order for osteoporosis to be diagnosed, you have to go through a series of tests, one of which is bone density scan. A bone density scan, or DXA, is an enhanced form of X-ray technology that is used to measure bone loss. Osteoporosis. Another way to test if you have osteoporosis is through a CT scan of spine or an MRI. A CT scan is an X-ray image made by using a form of bonography in which a computer controls the motion of the X-ray source and detectors, processing the data and producing the images. An MRI, a magnetic resonance imaging, is a medical imaging technique used in radiology to form pictures of anatomy and the physiological processes of the body. MRI scanners use strong magnetic fields, magnetic field gradients, and radio waves to generate images of the organs in the body. X-ray, an electromagnetic wave of a high energy and very short wavelength, which is able to pass through many materials opaque to light. Also, a photographic or digital image of the internal composition of something, especially a part of the body produced by X-rays being passed through it and being absorbed to different degrees by different materials.
If you look here, Miss Nelson, you can see that you definitely have osteoporosis.
Oh my gosh.
Hey! Oh no! I got a disease walking around through your neighborhood, spreading all my fleas. Everybody's like, what you got? I'm like,
Osteoporosis.
Treatment for osteoporosis involves slowing the rate of bone loss or increasing the rate of bone formation. There are two types of medications for this.
One type of medication is an anti-resorptive medication, which helps reduce bone loss by binding bone and preventing normal bone cells from reabsorbing bone.
Another type of medication is an anabolic medication, which is a medicine approved to treat men and postmenopausal women who have severe osteoporosis with a risk of high fractures.
These medications are man-made versions of the parathyroid hormone that have been shown to stimulate new bone formation, decrease the risk of spinal fractures, and improve bone density. Most of the medications used to treat osteoporosis require a prescription and a medical evaluation before treatment is started.
Compression fractures in the vertebra can occur as a result of osteoporosis. In these cases, vertebroplasty or kyphoplasty performed by a radiologist may be options to treat painful spine fractures.
With vertebroplasty, image guidance is used to inject a special cement mixture through a hollow needle into the fractural bone.
In kyphoplasty, a balloon is inserted through the needle into the fractured bone to create a cavity. Once the balloon is removed, a cement mixture is injected into the cavity.
In some cases of a compression fracture, surgical treatment may be required, especially if there is evidence of sudden narrowing of your spinal canal.